I think that some common misconceptions about breast cancer, and one thing that I find is that women assume that if they have a mastectomy, that the breast cancer cannot come back, that they would no longer be able to have a cancer on their chest wall. But in actuality, even after every mastectomy, about 2% of the breast tissue remains. And the breast cancer is actually generated from a single cell, which is microscopic. And this cell could be living in the tissue that remains after the mastectomy and could grow another tumor. And I do see a recurrence rate after mastectomy of about 5%. You always have to be very vigilant and keep up with being checked, but people think that maybe mastectomy might be the right choice for them because they think that it would not be able to have a possibility of coming back, and that's not necessarily true. Another misconception that I have that patients, when they come to see me, is that they usually have a copy of their pathology report and they've been studying it very carefully. And the pathologist has certain specifications that they have to list certain things on their pathology report. They list characteristics of the tumor, and one of the characteristics of the tumor is the grade of the tumor. And it's a number. It's a scale from 1 to 3. And so as soon as somebody sees the grade of the tumor on their report, they assume that is the stage of their cancer, because the stage is also a number, which is from 1 to 4. So they'll see a grade 3 and then automatically think, I have a stage 3 breast cancer. And the stage is really something that has come about to help determine prognosis, and it's based on completely different characteristics. It's based on the size of the tumor in the breast, whether or not the lymph nodes are involved, and if the tumor has gone to other parts of their body. It has nothing to do with the grade. The third misconception that I think that is out there is that that men potentially wouldn't have breast cancer, but about 1% of breast cancers are in men. So men too can also suffer from breast cancer. And in my practice this last year, I treated 100 breast cancers and one of them was a man.